Good morning, everybody. Happy Tuesday. We still have an amazing show for everybody today. What do we have, Krystal?
Indeed, we do. Lots of good stuff to get to. But first of all, Saagar, how are you feeling this morning?
I'm feeling a little bit better. So if anybody who missed it, I've got the big 19, the COVID-19, the Delta variant. It got me, finally found me in my house. But I think I am finally on the mend, Krystal. That's what I'm hoping. I think tomorrow, hopefully, I'll be back to like full capacity. And then I'm hoping to start testing negative then so I can get the hell out of my house because I'm starting to go a little bit of crazy here.
Yeah, it'd definitely be nice if we can get back in the studio next week. But more importantly, it would be nice for you to feel better. That's the number one priority.
Thank you.
All right, in the show today, we have update on what's going on in Afghanistan. Lots of people being evacuated over the last 24 hours, major uptick there. We have some complete COVID insanity going on in Australia that you just have to see to believe. I'll leave it at that. We'll show you that in a moment. Dems in disarray, for real this time. Break down all the details about the now 10 corporatists who are standing in the way of getting anything accomplished, the infrastructure deal or the reconciliation package at this point. Andrew Cuomo is no longer the governor of New York. It is official. We've got a fantastic guest on to talk about also that recall happening in California. That really is a jump ball at this point. And national media not paying that much attention to it, even though this could be a huge, huge deal. But we wanted to start with a major development on the vaccine front.
Yeah, the vaccine got big news yesterday with the Pfizer vaccine receiving full FDA approval. The president announced it at the White House. Let's take a listen to what he said.
So let me say this loudly and clearly. If you're one of the millions of Americans who said that they will not get the shot until it has full and final approval of the FDA, it has now happened. The moment you've been waiting for is here. It's time for you to go get your vaccination and get it today.
So that's a very important milestone there, Krystal, because the full FDA approval was actually cited by multiple people who I've spoken to, also anecdotally, but more importantly, in the Kaiser Family Foundation survey, they found that something around 12 to maybe 20%, the numbers are really, skewed. Some might have been using it as an excuse, but regardless, there was a certain segment of the population that said emergency use authorization by the FDA for the vaccine is what made them feel uncomfortable. Ultimately, the FDA did accomplish this in about, I think it was 40% faster than normal in terms of their review procedures. So I do want to put that out there. But really what it does come down to is that the actual review process of this, which many people were critical of, saying that it wasn't even going fast enough, is finally completed for the Pfizer vaccine. And that opens up the door to all sorts of legal mandates, which we're about to get into.
Yeah, I have to think there are some people who this will help to convince, because this was held out by vaccine skeptics as a kind of a trump card. Like, well, if the vaccine is so safe and so great, why does it only have emergency authorization right now? There are critics on both sides of this debate, as you just alluded to. Some people who said this went too fast. Why did you rush this process? Others who said, why didn't you rush the process more? I feel personally like they got it about right, because you need to, in order, if the goal is to instill the most possible confidence in people, you need to go through the entire normal process in order for people to have that level of confidence. They went through that process. They just did it at an accelerated pace. So that's where we are right now. Look, ultimately, what are the impacts going to be? Hopefully, as you alluded to, some of the people who have been waiting for that official authorization will go ahead and get vaccinated. More likely what's going to happen is you're going to see more companies and more federal government agencies feeling confident, hospitals, schools, those sorts of institutions, feeling like they now have the go-ahead to require their employees to either get the vaccine or to submit to testing on a daily basis.
Yeah, that really is, I think, the major headline beyond actually even the full FDA approval is that the president now urging private companies in order to mandate this for all employees. Let's take a listen to what he said.
Today, I'm calling on more companies, I should say, in the private sector to step up with vaccine requirements that'll reach millions more people. If you're a business leader, a nonprofit leader, a state or local leader, who has been waiting for full FDA approval to require vaccinations, I call on you now to do that. Require it. Do what I did last month. Require your employees to get vaccinated or face strict requirements.
That really is the big news there, Krystal. And, I got to say, it's interesting, and I'm also a little bit worried about how it's going to go because as I pointed to, I think I did a previous monologue, Kaiser Family Foundation found that 40% of people who were required to take a vaccine would simply quit their jobs. What we also know here, and I'm curious for what you think, is that right now, white-collar workplaces are the places most likely to require vaccination, where their employees are disproportionately more likely to get vaccinated in the first place. The major standoffs we're going to see are when working class employees are required to get vaccinated, where they are much, much more likely to be vaccine hesitant. So see that like if Amazon warehouses require vaccinations in their warehouse, something they have not done, and I think very specifically Walmart would be another example. That is where I think things could become quite dicey, and we could actually see some major political headway. We'll talk about it later with the Gavin Newsom recall, but the people who don't want this thing are extremely animated, and I would not be, surprised to see more states like Texas or Florida outright ban private, vaccine mandates that we could see, and it could just turn into a major political football. I'm generally of the opinion that incentives work better than mandates, and that, and unfortunately we live in a free country, but I'm curious for what you think on this, given that there is now full FDA approval.
Well, it's complicated because there's effectively two principles here which are at odds. One is the principle of a sort of, independent and freedom-loving tradition in this country, something I believe in, civil liberties, something I believe in greatly and, defend in a lot of contexts. The other is the responsibility that we have to one another, living together in a society. And I have to say, look, the backdrop and the context of all of this is none of these institutions, not the government, not corporate America, certainly has earned your trust to be able to institute these sorts of mandates. However, I do think, look, there for me are a few exceptions here. Number one, you're probably going to talk about this as well. They are moving forward with military mandate. If you are a service member, you're going to be required to get inoculated. Look, you're already required to get a bunch of other inoculations. You've already signed over your body to the U.S. government effectively. So I'm supportive of that. I also think if you work in a public health setting or if you work with children in a school, I think you should be getting vaccinated. So because you have these two principles, frankly, it's complicated. I didn't really have an issue with what Biden said. He's not putting the full force of the federal government behind it. He's saying, look, I can do this. I think the comment have struck down, like, and vaccinated have to get it. I really haven't that because there's still some of a choice. You're not stating that they ultimately get vaccinated, but it recognizes that if you aren't getting vaccinated, you are imposing a cost on those around you. And I have to tell you, Saagar, actually, your experience and our experience, and actually my daughter's experience, she hasn't been able to go to school for the last week. My oldest daughter, because she is vaccinated, but someone in her school who likely wasn't, contracted coronavirus, and that's had an impact on everybody around that person, whether they ultimately contracted or not. It's not like it's costless when you don't get vaccinated and you spread the virus to someone else. We're not in the studio this week. I had to be masked around my children all weekend because I was worried about spreading it to them. I haven't seen my parents because I don't want to spread it to them. So there is a cost that you're imposing on people by not ultimately getting vaccinated. And I do think that has to be weighed into the calculation without making the burdens like overly onerous or insanely authoritarian, like the things that we're going to show you that are going on down in Australia.
No, you're not wrong. That's the greatest balance, right? And yet, at the same time, I'm fully vaccinated, then I got the virus, and then, people I live with got the virus. So it's one of these things where what exactly are we trying to accomplish? I mostly agree with what you said, which is that especially whenever it comes down to the context of the type of employment, so like nurses in the ICU. Look, you're dealing with the most, vulnerable people in the entire healthcare system. I can't really see an excuse in order to be allowed to be able to spread that, possibly even more so than other people. And that's generally what the data does show us in terms of unvaccinated versus vaccinated. I also see this amongst police officers, right? Like police officers are literally required to interact with everybody inside of the general population. And the NYPD announced just yesterday they've already lost a third police officer to coronavirus. And I think the majority of their force is unvaccinated. At the same time, even though, we can both sit here till we're blue in the face, I really just wonder about how widespread the anti-vaccine sentiment is within so many of these communities and whether the mandate just may not work and could create some sort of civil crisis. That's actually what I worry about the most. I mean, I think it is the United States Marine Corps where I think a huge percentage of the enlisted population is not vaccinated. I mean, how many people are going to quit? Are they going to retire? Is it going to become some strange standoff with command? Now, maybe it's worth it. I really just don't know. It comes down to the forcing of people. The White House also is leaning very heavily into this. Jen Psaki was asked whether they're going to continue to push even more vaccine mandates, not necessarily like other diseases, but in terms of coronavirus, like when Moderna and others get full FDA approval. Here's what she had to say.
Will the White House convince more businesses to require vaccines now that the Pfizer vaccine has been approved by the FDA?
Will we require or will we push them?
Will you push them to businesses and require certain businesses to, or push them to businesses?
Sure. No, I just wanted to make sure I was understanding your question. We have already started doing that over the last several weeks, and I think you've seen the president speak to this. You've seen a number of senior officials be more forward-leaning, I should say, about the role the private sector can play in mandating vaccines or taking steps with their own workforces. That is always going to be decisions for them to make, but some may assess, and some private sector companies have spoken out about how final approval of the vaccine may help them take that additional step. So we are here, and we are here to be a resource as they have questions, but certainly we're hopeful this will help put in place additional measures around the country.
So there we go. That's kind of where we stand. And it's interesting because I do think that Delta does definitely change the calculus. Also, in terms of bringing back, but it's interesting too, even without vaccine mandates, Krystal, we've seen a massive uptake in actual vaccination. I think we're crossing the 1 million threshold all across the South because people probably just personally know, people like me who got sick. And you can see, I'm fine, I got the vaccine. I'm young, probably always was going to be. But what if maybe if I wasn't vaccinated, this could have been a 10-day disease instead of a 5-day. And people can look at that and say, hey, I don't want the 10-day. So in some ways, you can also just trust the experience of many people who are all across the country just looking around, knowing people who got sick and said, all right, screw this. I don't even want to risk it anymore.
That's true. But I think it's a fantasy to think that mandates don't work. Look, if there were more mandates in place, more people would be vaccinated. And that's what we've seen, like, for the example of France, where they've been a bit more heavy-handed. You've got to show your vaccine passport in order to get into restaurants or basically participate in life in France at this point. And there was an outcry, but there also were a whole lot of people who ultimately got vaccinated because there's a hardcore, maybe 10 to 15% that is truly adamantly opposed to getting it, period, full stop, doesn't matter. They'd quit their job, all of that stuff to resist getting this vaccination. Then there are a lot of people who just sort of feel like it's not really their preference. They're not afraid of the virus. They don't want to deal with the symptoms. They don't want to take time off of work. There's a whole variety of reasons why people aren't getting vaccinated. I think for that squishier group, look, we shouldn't delude ourselves that if you had more vaccine mandates, you would have more people getting vaccinated. So it's a question of how you balance these two competing values of civil liberties and having a whole bunch of corrupt institutions that have lied to Americans repeatedly, being in a position now where they actually are encouraging people to do the right thing, but there's good reason why so many Americans don't have trust in them. But so balancing the civil liberties with what our responsibilities are to each other in a society, I tend to think that the direction of, like I said, if you're in public health, public service, if you're working with vulnerable populations or with kids, then I think it justifies being more heavy-handed. And if you're working in a normal workplace environment, incentives, maybe you can either get vaccinated or get tested every day. That to me is probably the right direction to go in without the federal government using a whole lot of heavy-handed tactics to force that direction into being.
Yeah, I mean, this is the nuanced perspective which we're just lacking because, and I think maybe the reason I'm sounding some of the hesitancy is we see these like elite efforts where people want to deny care, to the unvaccinated, and there was Right. And it's just like, where does this lead? I mean, are we going to deny fat people dialysis? No, even though dialysis require, but you want to go and look at the spending charts. It's one of the things that the federal government probably spends the most on in the uninsured population. But I also know who those people are and exactly, what has led to all of that. So the slippery slope, it's like a libertarian dream that I've seen so many of these like elite liberals almost embrace. It's like, wait, I thought you guys liked the Affordable Care Act where you can't discriminate based on preconditions. Probably the best part of that entire bill, if we look back in retrospect. And now they want to overturn that. I think it's madness.
That is complete madness, and it's morally reprehensible. What you're referring to is there was a doctor who went on MSNBC and was like, I don't think that the unvaccinated should get care on the supposedly liberal or progressive network. Yeah. I mean, that's disgusting. Look, people make less than ideal health choices for themselves all the time. I'm one of those people, right? Whether it's sugar or alcohol or smoking or a sedentary lifestyle, whatever it is, you don't get to pick and choose who's worthy of care. If you believe healthcare is a human right, that's it, period, full stop. And, I saw the write-up on that and I went to look at like, how are people responding to this? Thinking that their reaction would be like ours, utter shock and horror that this idea has even been floated in a public context. And they were all like, well, I hate to say it, but they're probably right. And, yes, this is what we should do. The amount of support for that sort of draconian, morally suspect type of thinking was really, truly disturbing. And I think it gets to something we really try to maintain on this show, which is understanding where people are coming from, not demonizing them. I saw on Washington Post, they had a write-up of these Facebook moms who've hosted this vaccine forum where they allow skeptics and vaccine supporters to come in and sort of debate in good faith. And they actually are having much more of an impact in changing people's minds about the vaccines than someone who's just going to come in and yell at you and tell you you're stupid and tell you we're not even going to give you care if you show up at the hospital. So that sort of direction is completely abhorrent.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut. Our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.